I'd like to talk with you briefly about the benefits of, or the potential benefits of prenatal perineal massage. And this is a technique of preparing a person to release tension in the perineum as the baby is coming out. And it's done by the pregnant person herself can do the perineal massage, or her partner might do it. And so I happen to have with me a vagina puppet, and we're going to use her to help us understand this technique. I do want to tell you that there have been several studies looking at comparing perineal massage with not doing perineal massage, controlled trials. They've all been small, so it's hard to draw some great conclusions, but all of them have shown benefit in fewer tears or less severe tears of the vaginal outlet, and in places where episiotomies are very common, less need for episiotomy. So I'm recommending it, but I also understand that some people may be very offended by this whole concept, and I would say don't do it if it's offensive to you. So we'll leave it at that, and I'm going to show you what to do. So here's our puppet, very willing to pose for us. And if I were the pregnant person, what I would do is I would put my foot up on the toilet or the tub or something. I would make sure my hand is clean, and that I have a lubricant like olive oil so that I could to use on my thumb. And then I would reach around my large belly and insert my thumb as far as it will go into the vagina, like this. And I think there, I'm going to take my own foot down, but you have to imagine that that's what we're doing. I think it's a good idea at first to do a Kegel, the pelvic floor contraction, so that you can feel what tension feels like on your thumb and what release feels like. It's not a very dramatic difference, but it's important to know when it's tense and when it isn't. So once, and I wouldn't do that every time, but do it the first few times. And then with your thumb curled inside, then you would pull down and out the way the baby's coming. Pull down and out on the perineum, and only as hard as you can maintain a state of relaxation. If you're pulling so hard that you're fighting against it, that's too hard. You back off a little bit. And just so that you can feel that there's pressure but not pain. And then you do a U-shaped massage of the perineum, maintaining that amount of outward pressure that you had found was correct. You do that for about 3 minutes, and that's it. And you're done for the day. The studies have shown, there have been studies that have looked at people that have done it 21 days in a row. There are other studies that have looked at 4 to 5 times a week for 4 to 5 weeks before the due date, but all have found benefit. So I'm suggesting that you do that. Now, I also would say, if you only do it 2 or 3 times before the baby is born, I think that may still help, because you're getting the idea of releasing to that pressure, and that might be something that you could remind yourself of as the baby's coming down. Let go, let the baby out. So I think the more frequent use of this massage technique is probably more likely to protect the perineum. Now, one thing that people worry about is, I'm afraid I'm going to stretch my bottom and, walk around like this for the rest of my life. That is not what happens. What you're doing is you're learning to release to that pressure. You're not stretching it permanently by any means. So that's my suggestion that you do. Now, if the partner were to do it, and I think there are benefits to that, if the person herself is doing it, she has to relax and create the pressure at the same time. It's kind of like patting your head and stroking your belly. If the partner's doing it, the birthing person can focus completely on letting go. So if the birthing person, if the partner's doing it, the birthing person should be kind of semi-reclining. It's sort of like the vaginal exam position, with her heels up, her feet flat on the bed. And then the partner would use an index finger. So partners would be sure that their hands are clean, there are no calloused or roughed areas on their finger, and of course the nail is trimmed. And they would use a lubricant as well. Any oil, any vegetable oil out of the kitchen would be fine. You don't need anything fancy. And then the partner would begin with one finger and place it in the vagina, curl the finger, and insert it beyond the second knuckle, like this. And then while the pregnant person is releasing, the partner will increase some pressure, and then the pregnant person will say, that's enough. You know, don't go any further than that. That's as much as I can relax to. So the partner stops there and then begins the same U-shaped massage for 3 minutes. And that's it. They're done. After a while, some couples will go ahead and use 2 fingers. The partner will use 2 fingers for the same massage technique. It's a little awkward for me to show that, but you get the idea. But our whole point is more training the brain to release the tension than it is to actually change the anatomy of the pelvic floor. I wish you luck with that.